Good afternoon. Oh no, it's not yet afternoon. Good morning, ladies and gentlemen. That's not very nice. Thank you very much. Welcome to Yaba. Not very
Thank
far
you
from
for
Lagos,
staying tuned.
not very
Across
far from the
Nigeria,
island.
allegations of medical
Every
negligence are
person
raising
here
urgent
that
questions
came very early,
about
we want to
patient safety,
apologize
professional
that we're just
standards,
starting
and
now,
accountability
but there's a
in the
time
healthcare
that
system.
we say
Lagos to
God's
Kano, to less
So, if you
resourced
agree it's God's
states.
time now,
Families
please put your
say
hands together for
routine
yourselves
medical care
for turning
has
up
over
first
time
and foremost, and for believing in the process. And if by now a few persons don't know why we're here, well, that's why I'm here, so that I may ask you seriously. Tonight or this morning, ladies and gentlemen, we have kept quiet too long, and it is time for the voices to be heard so that people don't die anymore. That's the summary of why we're here tonight, this morning. I don't know why it's night, maybe because it's a bit dark in this place. So before further ado about anything else, there's a representative of the coordinating minister for health in the house, and by that it means that the federal government of Nigeria is represented here. So can I ask everybody to please rise as we do the national anthem of the Federal Republic of Nigeria. The first and the last stanza, if you don't mind. Thank you very much. You may be seated. Thank you. Okay. Thank you. Today, we've gathered in order to reimagine, according to the script, I'm reimagining healthcare through innovation and tech-driven patient experience. Whatever that means, in a little while, we'll be inviting persons to come and shed light on the significance of health. Somebody say today. Somebody say today is the appointed day. And therefore, no more speculation, but the actualization of a dream. Okay, I have a few persons here that I must acknowledge, and it is meet that we do so. First and foremost, every person who registered, we celebrate you and we say thank you, because if there was a gathering, if there was a vision and people didn't gather to be part of it, it's an empty hall and a man talking to himself. So please celebrate yourselves if you registered and you turned up today. Thank you very much. Before the acknowledgements, if there's anybody wishing to use the toilets today, just out there, I understand, male and female toilets are there. Thank you. Parking is free, but must be with wisdom, so that if anybody wants to leave, yes, they don't have to come look for you or announce your number plate. Thank you very much. We're not expecting any fire in this place, except the fire of the Holy Ghost. Amen. And if you see smoke coming from any table or from any aspect, please run. Thank you. That settles it. Okay. So, My Voice, My Health launch. Today is the day. I'm going to celebrate Dr. Ronke Agoro, if you're here. Dr. Ronke Agoro, are you here? Yes, please celebrate Dr. Ronke Agoro for me. Dr. Kayode Adeshola, President, Private Hospital Association, if you're here. Thank you very much, sir. Thank you for coming. Mr. Laolu Osoyin, the lawyer, is here. Is he? Maybe he's on his way. Princess Adenike Adedoyin Ajayi, Charter Consultant, Retired Permanent Secretary, UK Government, leads on citizen services, has patient experiences too. Thank you very much, Princess. God bless you. Dr. Hamid Adediran, the technology savvy doctor. Is he here? Okay. And last but not the least, all patients and lawyers in the house. Okay. Okay. I know there are very many more. So when the list gets here, we'll let you into who and who is here. We're going to have the opening and welcome address in a while, and from who other than the one who has the vision that has aligned with other visionaries in order that vision may be accomplished. Because if a man does not state his vision, it's just a television. Am I with somebody? Hello? So help me with your anointed hand. Celebrate one and only Dr. Kunle Thomas. I make you doctor for today, don't worry. He is a Lagosian, even though he does not live here. So please celebrate him for me. Thank you very much. Okay, I'd like to acknowledge the presence of the Lobe CMD. If he's, are you here? Thank you. Okay, 1,000 apologies. Okay, in his capacity as the coordinating minister for health, he gave his word that was going to be here, but that if he wouldn't make it, he would send an able-bodied representative. And therefore, ladies and gentlemen, help me celebrate Professor Wasiu Lanre Adeyemo, representing the coordinating minister. Thank you very much, sir. Thanks for coming. Congratulations. Yes. So, Mr. Thomas, the one that is not doubting.
The representative of the coordinating minister for health and social welfare, Professor Wasiu Lanre Adeyemo. We appreciate your presence here. Thank you very much. A round of applause again for him, please. Other distinguished, we've got a lot of distinguished clinicians and leaders within the health sector here. We appreciate your presence. Thank you so much for coming. And every guest present here and those who are watching through the live stream that we are projecting, thank you so much for your time joining us this morning. As we begin to reimagine healthcare through the lens of effective technology-enabled patient experience, I think this is vitally important that we start to discuss this in more detail. And I'm pretty sure there have been things going on in this area, but we are kind of very intentional and very purposeful about this and hence this event. And as you know, we're not just going to be discussing reimagining healthcare through effective, dynamic, and technology-enabled patient experience. We are going to back it up with action, and that action is the unveiling of a new product, a new service within the health sector, possibly one of the very first nationwide that is digital. So a digital means of collecting feedback from patients, their families, their carers, even those working within the hospitals and other health facilities, basically for everybody. And so to start to collect this data about what is working well, what is not working well, and what other things could we be doing. And by analyzing that data, by using that data to inform policy and to ensure that there is continuous improvement. And that is the very reason why we are today launching MyVoiceMyHealth. So, and we're going to have a few moments when we'll do the actual formal launch. So, so it's a great pleasure to be here, and it's a great pleasure to welcome everybody here present. You have made it through the rush hour of Lagos, which I know is not a task for the faint-hearted. So thank you so much for being here, and do have a lovely, lovely time as we deliberate together and contribute our own little quota as to how we can move good healthcare through the lens of effective, enabled, technology-enabled patient experience forward. Thank you so much.
Thank you, Dr. Thomas. I'd also like to acknowledge the presence of Mr. Dipo Odebowale, representing Honorable Abike Dabiri, Nigeria Diaspora Commission Chairman. Thank you very much, sir. Thanks for coming. Okay. Without much about wasting time, I'm going to invite the representative of the coordinating Minister for Health and Social Welfare, his representative, Professor Wasiu Lanre Adeyemo, to give us his keynote address. Let's make him feel very welcome. Thank you.
Good morning, distinguished ladies and gentlemen. The organizer of this very important platform, Mr. Kole Thomas, and all his team members, the leaders, distinguished leaders of opinion in health industry, particularly those in private and public. You are all recognized here. Members of the academia, I can see one or two here. You're also well recognized. The NGOs are here, and also I'm also aware that technology savvy personnel are also very important here, because this is about digital, this is about data. They have to be here. And I'm also aware that the representative of the DG Diaspora Commission is here. You're also well recognized. The members of the press, you are recognized, distinguished ladies and gentlemen. The Honorable Minister of the Coordinating Minister of Health have asked me to represent him here, and it's my pleasure to represent him at this very important event, focus on reimagining patient experience in Nigeria and the launch of MyVoiceMyHealth portal. I want to commend the Patient Academy International for this laudable initiative. MyVoiceMyHealth platform gives every patient carer, and advocate a clear and safe way to be heard. Feedback thereof reaches the right people and leads to better health care for everyone. The platform therefore represents communities advocate for better health care. The federal government of Nigeria remains committed to strengthening a healthcare system that is people-centered, equitable, safe, and responsive to the needs of all citizens. Improving patient experience is a critical component of health system reform as it promotes trust, accountability, and quality of care. The National Tertiary Health Institution Standards Committee is a Nigerian regulatory body established under the National Health Act of 2014 to set, monitor, and enforce minimum standards in federally funded tertiary hospitals in Nigeria. It focuses on improving quality, safety, and ethical standards, including organ transplantation to reduce medical tourism. The Standard Committee develops national standards and conduct inspection for the accreditation of a tertiary hospital in Nigeria. The committee also partners with bodies like the Society for Quality in Healthcare in Nigeria to train teams, improve performance, implement a ranking system. It also sets guidelines for and combat unethical practices. Established under Federal Ministry of Health and Social Welfare to address healthcare governance, it comprises of seasoned healthcare professionals representing all geopolitical zones and utilizes a performance-based ranking system and improvement checklist to ensure accountability and a culture of quality. In furtherance of quality improvement agenda of Federal Ministry of Health and Social Welfare, national standards for facility accreditation are also being enforced to elevate quality of service delivery in our healthcare centers across the Federation. Memorandum of understanding have recently been signed with two healthcare quality organizations, Farm Access and the Society for Quality in Healthcare in Nigeria, to assist our hospitals move up the rungs of healthcare service quality. Patient engagement and structured feedback mechanisms are essential tools for continuous improvement. They enable policymakers and healthcare providers to better understand the realities faced by patients, carers, and their relations. Also to identify gaps in service delivery and develop evidence-based intervention that improve health outcomes. The Federal Ministry of Health and Social Welfare recognizes the growing role of digital platforms in enhancing transparency, improving governance, and strengthening communication between healthcare providers and the public, particularly patients and their relations. Initiatives such as MyVoiceMyHealth portal have the potential to support real-time feedback, data-driven decision-making, as well as quality improvement across both public and private health facilities. However, as we embrace innovation, it is equally important to ensure strong regulatory oversight, data protection, privacy, and interoperability with National Health Information System that is already well established in Nigeria. Nigeria's National Health Information System is a comprehensive Federal Ministry of Health managed framework designed to collect, store, and analyze health data for evidence-based making decisions. It primarily uses web-based platform for tracking service delivery, covering areas like maternal health, nutrition, and disease surveillance. The Nigeria's National Health Information System aims to improve data quality. The Federal Ministry of Health and Social Welfare will continue to provide policy direction and collaborate with stakeholders like patient, Patient Academic International to ensure digital health solutions align with national standards and priorities. We therefore encourage continued partnership with among government, the private sectors, the NGO, civil society, and development partners in advancing patient-centered care. Together, we can build a resilient health system that delivers quality, safe, accessible services to all Nigerians. In conclusion, I commend Patient Academy International for this initiative and wish you a successful launching of the platform and impactful outcomes. Thank you very much.
Thank you very much. Professor Adeyemo, representing the coordinating Minister for Health and Social Welfare. Thank you very much, sir. God bless you. I have a few more persons to acknowledge. Professor Koforola Odeleye, College of Medicine, Public Health Specialist 2. Are you in the house, sir? Mr. Dipo Odebowale, representing the Honorable Minister Aldiji for Diaspora Commission, Abike Dabiri. If you're in the house, Mr. Dipo Odebowale. Thank you. Yeah, I did that earlier. Private sector doctors, especially from Shell International, Dr. Folusho Alamina, Bulola Lily West. Are they here? Are they here? If you didn't register, before I go any further, it's important that you register as you come in, so at least we know you're here and we can cater for you as well. Thank you. Friends from Popular R. Jollard Hospital and other private hospitals, ably represented by Dr. Kayode Adeshola, President, National Association of Private Hospitals. Are you here? Are they here? Oh yeah, thank you. It's good, you just get double portion of recognition. It's okay. Lawyers in the house too, lawyers. Journalists in the house. Just wave. Thank you very much. I have Dr. Oshunkoya, CMD Marigold Hospital, Surulere, Flagship 1, Director of Patient Academy International. Thank you very much, sir. God bless you. Now, because we've celebrated everyone in the family of Patient Academy International, we agreed that the technology that will back the vision is vital. And therefore, it will be very, 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 very short-changing not to recognize the members of the board of IFONOVA, their support system. So, in no particular order, Kelechi Onwosu, thank you very much. Adebayo Akinwumi, and last but not the least, Ade Adenuga. If you want money tonight, is also related to the very rich one, yes. Any surname you hear that, thank you very much. Okay, moving on swiftly. For all those who just came, if you wish to use the toilets outside there, thank you very much. And if you need to park, please park safely outside there so that if anyone needs to move. We're going to show you a video now, if my guys are ready. And it's simply about MyVoiceMyHealth, a showcase live demo. Adelola Alao, are you in the house? I understand you are chaperoning this. Please come. Unfortunately, we don't have popcorn to go with this one, even though it's a little movie. Thank you.
Good afternoon, ladies and gentlemen. Is it morning? Okay, I hope you noticed the accent. Okay, it's still morning. Okay, good morning, ladies and gentlemen. Morning. A round of applause for this shy girl that is trying to talk to big people. Okay, so in a few minutes, the system will come up. We are going to show everyone, do a quick show and tell of the MyVoiceMyHealth system. But before we do that, just to engage everyone, because remember, there are different stakeholders at play here. We have the ministry, the government, we have technology partners, we have decision makers, who work together to achieve the same goal. As we all know, especially in Nigeria now, healthcare is one of the biggest concerns or issues that need to be addressed. If we have food, we have shelter, and we don't have healthy Nigerians to, make Nigeria what Nigeria needs to be, then we will just have chairs and tables, in the room. If we don't have our mothers who are healthy enough to raise our children, what happens to the next generation? If we don't have healthy government workers to take care of the country, what happens to the country? If I don't have a healthy MD like Mr. Kelechi Nwosi, how am I going to get my salary? Because he will use the company money, God forbid, in the health system. So healthcare, as much as, it feels like a basic, thing, is actually a very core, essential part of us existing, not just in this country, but also thriving, right? And making Nigeria one of the true giants of Africa, and hopefully one day the giants of the whole world. I strongly believe that Nigeria has the potential to do that. And health is one of the pillars. Good healthcare is one of the pillars that can potentially make that happen. Engineers, are you ready? Okay, so can you display the poll, please? Thank you. So before we go to the system demo, I just want us to do a quick exercise, 2-3 minutes. If you can use your phones and just scan the QR code here, we're just going to take a few polls just to get the minds of, the stakeholders here. We are the power of Nigeria. We are the ones that have come together because we are concerned about and we want to improve healthcare, in the country through digitalization and technology, right? So let's start by taking digital polls instead of writing it on paper. Apologies, I'm moving. So if you can take the QR code. Should I move further? Okay, I'm running. Okay. Is it better now? Oh, to the door, I'm here. All right, here we go. Okay. So just let me know once you're good so that we can start. Okay, that's what I want to hear. No active poll. So can we start now? No? Yes? Okay. If you are using the green network, I did not mention any name. I just said the green network. Maybe just shove a little to the person next to you and tap from any other color. I have maybe the other colors in the rainbow will work. If you are using a red network and it's not working, try to just shift to somebody who probably has a yellow one, right? And if the yellow one is not working, and the red one is not working, and the green one is not working, I don't know. The green one is not working. No, yes, you want to see no active poll, right? Okay, sir, you have to put the code. So the code there is 1087458. Okay, can we move on now? If you see no active polls, then you are at the right place. We just wait to start. If you see an interface that asks you to put a code, you put the code there, 1087458. Okay. Can we start now? I'm really trying to improve my English accent, so please. Perfect. Okay, thank you, ma. Okay, so Big Madam here said I'm good the way I am, so I'll try the Jebu accent. That's where I'm from, so it's okay. All right. So, engineer, let's move to the next slide. So the first question here is for you, right? And again, you can choose multiple answers, right? What is the biggest challenge you faced in a healthcare facility? So this is your personal experience, okay? Or on behalf of people that you know. What is the biggest challenge? Is it long waiting time, poor staff attitude, high unexpected costs, availability of drugs, wrong diagnoses and prescriptions? So let's see. All of the above. All of the above, who did that to you? What hospital did that to you? On the same day, on the same experience, that's a lot. That's a lot to deal with at the same time, I must say. Wow. Okay. So, from the poll, we can see that at least it's still shifting. Okay. But it seems like long waiting time seems to be the most pressing, right? And poor staff attitude. Then we have unexpected costs. You see this unexpected cost, ma? This unexpected cost, ma, I'm going to sue people because we went there thinking we're going to spend 10,000 naira. We come out spending, sir, how much did we spend the last time? 200K. That's somebody's school fees, other people's house rent. There's no house rent that is 200K again, just school fees. Because we are engaging. And you said that my accent is fine the way they are. So the person that accepts my accent, I will talk to. Okay. So, ma, just quickly, because we are friends now, right? What do you think? Let's start with the second to the last before we address the first one. Poor staff attitude. Nurses, doctors, technicians, the cleaners. I'm assuming we're talking about all of them, together in the facility. What do you think, off the top of your head, we can do to do a quick turnaround in fixing that problem? Just off the top of your head.
The first thing is to train them. You train them. And the second thing is to have mystery shoppers and let there be consequence management. When there are mystery shoppers who will go there, they will know that what you've been trained, you are not doing it, and there are consequences. With that, there's no sacred cow. Everybody can be taken down. Then we'll start seeing a shift.
Excellent. A round of applause for this lovely, lovely, lovely best friend that I've met today. Besties. So by mystery shoppers, you mean, auditors, people who come to check anonymously. You don't know who they are. They just bust in one day and they, like normal, exactly. Somebody has an opinion here. Good afternoon, sir. Your name, please.
Good afternoon. I'm Kelechi. So, yeah. Okay, so at a couple with agreeing with her, in addition to what she said, I think the first in our environment, I think what should come first before training is better staff remuneration and better adjustments to their shifts, because you can't have someone working 24 hours and you expect the person to give a good or a better attitude when emotionally drained, and all that. Someone could work 1 hour or 2 hours to work, and then you expect the person to, we need to, I think that is one of the problems we need to sort out in Nigeria first, because remember, that is why we're having the brain drain.
Yes.
Thank you.
Okay, excellent. A round of applause for Mr. Kelechi. Okay. Yes, ma'am. Okay, one more, and then we move on.
In addition to the two submissions presented, I think what needs to be looked at is
has to do with the fact that proper staffing as well is very vital. It's very common for you to say that in public hospitals in Nigeria, you may see like just about 4 doctors or 2 doctors on duty over 200 patients. They are human beings, and there's no way they can cope with the volume of patients waiting to be treated. Thank you.
Thank you. Thank you very much, sir. Okay, so I'm just going to give one more person to talk about what we can do about long waiting time. Okay? Long waiting time. I'm very sorry, sir, because we have to move. You know, okay. Does anybody have an opinion about how we can handle long waiting time in the hospitals? Or do we think that the opinions that we've given for the second option works for the first? It still affects it. Excellent. Okay. Thank you all for your engagement. Let's move on to the second poll quickly. So the second one is, there are no options there. You just type in your opinion, okay? And we'll see the answers come here. So it says, after an excellent or bad healthcare experience, what do you usually do? Do you just go home, complain to your family about it, and do you go to social media and blast them? And do you call your brother's cousin, sister's brother's wife who owns an hospital that is a parent to the other hospital and report them? And what do you usually do? Complain. Leave to what? Leave it to God. Leave it to God. Escalate to management. Complain to whoever cares to listen. Talk to a friend, family about it. So this is what we typically do, right? And this question came in to help us open our eyes to the fact that after we do all of this, how many of these reactions actually get a solution to the problem, right? And that is what My Voice, My Health has come to address. Now let's get this feedback the right way, in a digitalized form, without any human or bias interference. And let's get it to the right hands, to the right authorities who can actually do something about it. And we can measure change, right? Excellent. Thank you, everyone. One last question before we move to the demo. Would you use a platform that allows you to share healthcare feedback anonymously via voice or text? If you press no, I will know, and I will come to you. Okay, I love the fact that we have yes there. So it means that we are all working with the same mind, right? That we want change in Nigeria, we want change regarding healthcare, and by the grace of God, we will get there. Thank you, everyone, for participating in the polls. We're going to move to the system demo now, and I'll try and wrap that up in the next 5-10 minutes. Okay, so like I mentioned, Ifonova Limited, in partnership with Patients Academy, we've brought together this platform. Simple. The idea is, let's create a simple-to-use platform where the typical Nigerian, for example, and you know, we also have a big dream to get this global, but let's start from home, right? Whoever is experiencing healthcare in this country, let's create a simple way in which they can articulate this feedback that we are saying when we get home and we tell our dad and our mom and our uncles and our friends that cannot do anything about it. Let's create a safe space for them to be able to give this feedback and you know, transfer this data or make this data available to the right people, the right authorities, people who can actually advocate for the Nigerian, people who can actually do something about it, people who can go in secretly, like Madam said, right, into these spaces and confirm the situations that have been reported, okay? And then we can now push for truth, because there's a popular saying in Ifonova Limited, what cannot be measured cannot be improved upon. If you cannot measure it, if you cannot get insight, if you cannot identify what exactly the situation is, you cannot do anything about it, not to talk of improving the situation. Okay? So let's log in. We log into the platform, and when you log in, you are presented with, of course, different questions to fill. Now, remember that apart from the feedback itself, it's also important for us to understand the demographic of people that are giving this feedback, right? So it's not just about the problems, it's also about the types of people or the categories of people that are facing these problems. Say, for example, there is a problem that is very specific to women, for example. If we don't catch the fact that this problem is happening to the female gender between this age and this age, right, we will not be able to get to the actual target or get to the actual root of the problem. So apart from your name, the normal information that we usually fill in forms, there are demographic information that the typical Nigerian needs to feed into this system. Because let's tell ourselves the truth, we don't have a solid information data bank, targeted towards this kind of objective, or is not robust, if any exists. So this can be a good starting point for us to start building that, bank of information that, stakeholders in the health industry in Nigeria can take advantage of and use to make the improvements that we are talking about. All right, so for example, you have different personas that you can identify with. You can report as a patient, a caregiver, an NGO representative, or a local government representative, right? So some of these people who can come in secretly to monitor or observe could be from the local government. They could be from the state government. They could be from the federal government, right? So you can represent yourself according to your persona. So for the sake of this demo, we're just going to choose a patient. And as a patient, you can choose if you are giving this feedback on behalf of yourself or on behalf of somebody else. So if, for example, a mother, right, who has a 2-year-old baby who actually had the experience in the hospital, the 2-year-old child cannot give feedback on the system, but his mother can represent him, right? So you can give this feedback on behalf of yourself or on behalf of someone else. So when you give it on behalf of somebody else, you give your information and you give the information of the patient also. If you are giving it on behalf of yourself, obviously it's just your information that you're putting in. So for the sake of example, let's just click ourselves, right? And then you have the option to give this feedback anonymously. So if you don't want your private information to be out there, it is fine. What we are targeting is the actual feedback, right? So if you are uncomfortable with putting your personal information, you can still go ahead and give this feedback, right? So you can choose to give this feedback anonymously. And if you want, your information out there, that's also fine. It will also be treated under the data policy governance rule, right? So let's just give a sample name. Let's say somebody from the north. Since we're in Lagos, let's go to the north. Right, so we can give your phone number, your email address. So the idea behind giving your contact details is if, for example, you need, there is a need to get back to you, right? Confirm information, or if it's a case where an NGO needs to pick it up on your behalf, right? There are so many situations where you might have to be contacted in order to get the process to the end. And if you don't want, a follow-on, of course, you give your information anonymously, but at the very least, you have, a representative or a stakeholder, at the very least, confirming the situation and doing something about it. You are facing the institution anyway, right? So I can put my information, and then remember we talked about demographic data, right? So your gender, your age range, do you have a disability, education level, all of this helps with the analytics, that happens at the end, the data analysis, which will also lead to better decision making when it comes to the healthcare. All right, so we can fill all this up and then continue quickly. Okay, so let's continue. So now, feedback here is categorized into different sections. You have compliments, complaint, concerns, comments, general comments, and patient safety incidents. We have a culture of only reporting bad things, right? We need to imbibe the culture of also giving good feedback, right? Because, hey, guess what? There are people who are actually searching online for people's recommendations about hospitals for specific situations, for doctors for specific situations. Information like this can help them, make an informed decision on where to go to do this, by giving compliments, by highlighting what works in this institution and the other, right? So you have compliments, complaints, and concerns and comments. So you can choose any one of them. And if you hover over any one of them, the system gives you a good explanation of what this means, right? And the context behind it, so that when you are choosing with an informed mind. So, but because we know that we complain, so let's choose a complaint and then move on. Okay. So we complain, we choose a complaint, we continue. And then we are trying to identify the facility itself. Okay. So we choose the state. Let's choose Kano State for the sake of, being diverse and all of that good stuff, right? And then, we've noticed that a lot of people might not necessarily remember the local government area itself, right? Those details. But of course, you would definitely know the name of the facility, right? So if you put the name of the facility, then the system gives you the other information by default. So what facility name should we use? What facility is in the north? FMC. General hospitals exist anywhere. Well, I'm trying to check my notes. I think I have a specific one here. Abubakar Imam Urology Center. I researched that name, a name that is in the north. So while we're looking for that, I think it's very good to mention that the system currently has about 50,000 facilities in the database, and that database is growing every day, right? And we've also made accommodations for users to put in the name of the facility they're referring to, just in case they don't find it on the list. And we have people working at the back end, constantly validating that information and then adding it, so the database is growing every single day. And, definitely at some point we would have covered, well, we can never cover 100% because new facilities will always be open, but we can be close to, want to reduce the chances of you not finding your facility on the system, okay? So you see here, the system automatically figures out the local government and the type of facility, right? So we continue. I hope I'm not boring us. Okay, all right, thank you. So you put a date and time of the experience. You don't necessarily have to know the exact, time, but you definitely have a window, of remembrance of, and if you have documents, you will definitely be able to get information like that, right? And then issue classification also helps us to further classify and group these issues, right? So okay, let me wait for my assistant to quickly go through this. Okay, so you can choose the type of issue that you are referring to, right? Is it staff attitude, rudeness? We talked about that in the polls, right? You have communication error gaps, appointments, cancellations, food-related problems. You can choose this. And again, we have opportunities to add more if you feel like any of the categories here don't fit what you are referring to, okay? So we select any issue, sir. Any issue type, and then you can also identify if this issue was life-threatening or not, okay? And this helps inform the people at the back end dealing with this, who takes care of what, right? All these identifications help us to know who do we push this to, who do we route this through, and the rest of them, okay? Sir, is it life-threatening or not? Okay, he said it is, so we go with that. If the matter is yet to be resolved, do you need advocacy and the rest of them? You choose that. And then there are other, so there's more information about the health facility that you can add. If you remember, all these are optional, but you can put the department, the nurse, the doctor's name, specific information if you have them and you're willing to provide it, for the issue to be addressed. Then you can do a short description of this issue, right? And an added advantage is if, for example, you cannot, properly articulate what you want to write, you can use the voice recording feature, right, and express yourself with an audio message, right? So that will be sent to the back. We have people who will treat that. So we have multiple options, and we try to accommodate, as many different types of people as possible in our demographic, okay? And then you can also talk about the impact of the issue. Is no impact, minimal, moderate, significant, and the rest of them, okay? So, engineer, let's go. Okay, can you play the recording? Let's see if it plays out.
This was a critical issue.
Okay, so that's my engineer back there. He just recorded a voice note. So you can do that, right? Replay it, delete it, and, replay another one if you're not satisfied with what you have recorded, okay? And then we continue. And then you can also added evidence, documents from the hospital, pictures, video clips, whatever evidence you have to help with your feedback or your case, right? You can add anything. Let's just add a file just to, help us. So you can see all the different formats that are supported: MP3, MP4s, PDF files, pictures, videos. So you can attach extra evidence to help with your case. So let's continue. And then you can add further comments if you have any. Let's continue. You can add, other information. Remember, I said that demographic information is very important, but it's not, gone to your head. But it will definitely help with those who are addressing these issues when we are doing data analysis and all of that. Remember that one of the biggest things we're adding to the table is a technology-driven way of handling, feedback. And when you are using technology-driven methods, data becomes very, very important, right? And different types of data, the more types of data we have, the more categories of data we have, the better we can improve or achieve our goal or our objective, okay? So now, when we've done all of that, the system allows you to review everything that you have fed into the system, right? And you can edit. You have the chance to quickly make edits before you now finally submit. So let's submit this. Well, before you submit, obviously, you have to confirm that the feedback that you have given is true, is a true reflection of your experience, and we submit. Simple, straightforward, and available for everybody to use, okay? So before I go, I just want to quickly show us a peek of the back end, because we're talking about data. How is some of this data represented, right, to the stakeholders who are looking at what is being fed and how they can work with the information. So let's just quickly take a blink of this. By the way, before this launch, we kind of made this available to like a focus group of people to give their actual real-life experience. So what we are looking at here is real-life information, real-life experiences from real Nigerians who have been put into a room, right, to give their feedback on the system, so that we have real-life information to show you, to see that this is what, quote and unquote, people are going through, right? And how stakeholders can use this information to make change happen, okay? So, for example, on this dashboard here, you have total number of submissions, you have the total number of complaints, concerns, compliments, comments, and safety incidents. Right now, the system has recorded 51,000 plus healthcare facilities in its database, right? And from that focus group that we made the system available to, we get feedback attached to 65 different healthcare facilities, okay? So, in terms of grouped data, you have the top issues that have been identified, right? We can drill this down to top 5, top 10, I believe, but these are the top 3. So just from that focus group, you have staff attitude, rudeness, critical errors, and co. So at the very least, we can tell that this data is aligned, because just on our poll, staff attitude and rudeness was one of the top issues that was identified, right? Exactly. So we can tell that this is a real problem. And some of these suggestions that have been brought up today can be used by the stakeholders, right, to drive change, orientation, handling their work shifts, all of those things that we suggested. But like I said, if we're not able to properly identify the problem, we don't know where we are going to, what to hit, what are we going to fix. And then you have top complements here. The top 3 are facilities and environment, short waiting time. I'm assuming those are private hospitals, right? Okay, somebody is agreeing with me. Quality of care, okay? So let's scroll down a bit more. Here we have particular hospitals, okay, that have the feedback. So we have about 61 hospitals, I believe, that we got feedback on. Out of those feedback, this is like about 5 or 10, I believe. And you can see a quick breakdown of the kind of feedback that has been given against those hospitals. So for example, Ikorodu General Hospital, you have 3 compliments, 1 comment, right, and stuff. So just from dashboard, we can say, on average, okay, this hospital is good. There are some that will have more complaints than anything else. Just by that dashboard, we know, okay, this group of people need to go to this hospital, observe what is going on, confirm, the feedback that has been said, and start to work on fixing the problem, okay? So there are different ways in which you can target problem areas on the system. This is just the landing page dashboard. There's more information on the admin and all of that, but just to give us an idea of what comes back and how that data can be used. So this is MyVoiceMyHealth system. If we all check on our name tags, you will see a QR code. That QR code leads us to the MyVoiceMyHealth platform. We want to encourage everyone to please use the platform and spread the word and give people the opportunity to give their feedback. Thank you, everyone. I appreciate your time.
Dear Lala, thank you for a beautiful job. If you weren't the one, or if you weren't part of the people who put this up, then you must be very good at reporting. Let's celebrate her once more. Thank you very much. Okay. Somebody say, wow. Somebody say, wow. You're not convinced that this is good, right? That's why you're not responding. Somebody say, wow. Somebody say, well done. Thank you very much. I'm going to correct an introduction that we did earlier. Somebody can be representing anyone, but he himself must be representable. Am I with somebody? So I've been introducing Professor in a way that is not the full Monty. Do you understand what that is? So in slow motion, ladies and gentlemen, the Chief Medical Director, Lagos University Teaching Hospital, Professor Wasiu Lanre Adeyemo. Thank you very much, sir. God bless you. So, okay, so moving on. It's time for the panelists to come to the stage, and we have 6 of them. And then we'll take it from there, because right now, that is the stage that we're at. So, Dr. Ronke Aguro. Just choose any seat you want, any seat. You're the first. Okay. So, okay. Thank you. Did you clap for Dr. Ronke Agoro? I can only see some people clapping. Thank you very much. Dr. Kayode Adeshola, President, Private Hospital Association. Are you here? Please join. He didn't even use. Mr. Laolu Osanyin, a lawyer. It's not here. Princess Adenike Adetoyin Ajayi. The clap offering is going down. I don't know why. Thank you very much. Dr. Hamid Adediran, the technology savvy doctor. And I have where are the rest? Where are the persons? That's all. The 4. Okay. So we have a moderator in the person of Dr. Hamid Adediran. So the idea is check. Okay. Dr. Shikoya, please come and join us. Thank you. Please celebrate him for me too. Thank you. Doctor, please come. Doctor, please come. Zonan. Thank you very much. Unless there's someone here who does not mind joining the panelists. Otherwise, we just go with the ones that we have. So we have 4. Ross, Doctor, the ball is in your court, whether you play tennis or not. Thank you.
Depends on the kind of ball. Good. Okay, I should go there.
Oh, yeah. The first one or the second one? The last one. The last shall be the first. Oh, yes, there's a lady there too.
Okay, good. Oh, finally we can say good afternoon. Everyone has been mistakenly saying good afternoon all day, right? Am I the only one? No. Right. Like we just came here and everything looks like it.
We've been here for a long time.
Mic check. Mic check. This mic is failing. Check. Mic check. Good. So, good morning, everyone. With special mention to the representative of the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pati Rebli, and I'm sure in his own physical capacity, the CMD of Luth. It's good to see you again, sir. Always a pleasure seeing you, sir. Distinguished ladies and gentlemen, we're about to start a conversation that I'd say is the essence of everyone coming here. I believe that we're all here because we believe that healthcare service delivery should be all about the patient. If there's anyone with a contrary opinion, please say nay. The ayes have it. So for us to have this conversation, I have a very rich panelist. I know they've been rightly introduced, but please permit me to tell you a bit more about them so we can put a context to the conversation. With me on the panel is, oh, I thought I had them here. So I have them have a go at the concept of patient-centered healthcare delivery. We talk about it, we've heard it quite a number of times. So let me start with you, Princess. From where you sit, from your experience, what does patient-centered healthcare delivery mean to you? I can hand over the microphone back. I'll return it.
Good afternoon, everyone, and particularly the organizers of this very, very serious program. It's very serious. It's something that's got to do with people's lives and preservation of life. So it's very, very serious. It's very important. So I thank you for having me as well. And I say good afternoon to my fellow panelists and all of you that are here seated. Why did you lost me on the question again? Sorry.
So from your perspective, what does patient-centered healthcare mean?
Well, it's self-explanatory, really. It just means that we become more patient-driven. See, hitherto, a lot of people believe that they are doing the patient a favor. Generally, you know, when people are giving services or delivering services, they believe that they're doing those people that are coming to get the services, they're doing them a favor. So that in itself has already knocked them down from giving their all to the services that they're providing. Secondly, the people that are also getting the services are not realizing that they are the king, because customers are always king. So if we can all, the service provider, the service receiver, if we can all sit down and really think about the services we're providing and the people we're providing it to, we will then be able to put in place a more customer-driven, not customer-focused. See, when you're customer-focused, you're just thinking about what the customer wants from your perspective, from your point of view, what you think, because you are the experts, you are the providers. So you are thinking about what the customer wants or what you think will satisfy them, and that's being customer-focused. But when you become customer-driven, everything that you're giving to the customer is informed by the needs of the customers when the customers tell you about it. When you take the time to ask them through the various things that we can do. It can be a poll, it can be customer, you know, whatever it is. Just collect those information so that you are delivering a service that is customer-driven. That is how you can meet the customer's needs. Thank you.
I like this. We started from patients, we landed in customers. Patients are customers. Those in support say hi. The eyes have it. So, Dr. Aguru, you're a public health expert. From your experience, looking at the health sector as a system, what does patient-centered healthcare mean to you?
Hello. Good afternoon, everyone. Thank you very much for having me here.
Well, I think she's using the American accents, and that's why the volume, she sounds low. So let's, let's do a Bute Meta style or Yaba style now.
Thank you very much for having me here. what does patient-centered care mean? From my perspective, it means that, just similar to what Princess said, it means that the care that is being provided to the patient / the customer is actually to make them better. Not on the other side where you have providers thinking that this is what the patient wants. So you find out, and talking as a patient at some point in time or a relative of a patient, that I have had the experience of where patient's voice is not heard. It is like a routine questioning and all that, and the patient's communicating with the healthcare provider is null and void. And I say this from experience. I've had the experience of being a patient in 3 different countries. And there's a commonality there where the patient is like, it's like a factory. I had a doctor, and I remember her name very well, Dr. Chitaki, in New Jersey, United States, prescribed me a drug that almost killed me. She did not listen to what I said. And I had to call my cousin who was a nephrologist, he was still a nephrologist, and I said, I was prescribed this, this, and this. And she said, did they tell you it locks your locomotive system? I said, no. I said, stop taking it. I stood in front, I was crossing the road, and I stood in front, and my system just shut down in front of a bus. And the bus was coming at me, and I couldn't move. And somebody had to push me out of the way. This was in 1996. Now, if I had time and nothing better to do, I would love to go back in time to sue that person out of it. But, I mean, I was much younger and all that. I didn't have the strength. Just being okay was good enough for me to actually follow through, because you know their system is more litigation. You could report and all that good stuff. But that's not even what it is. What I realized, what I went in for was ulcer. And I kid you not, before I was done, she prescribed me a medication. Did she listen? So, like Princess said, I was being done a favor. When you start looking at it like that, it becomes a situation of king and servant, instead of a win-win situation. Because if you don't have a patient, I have a feeling that there's no job on the other side. Thank you.
Absolutely, thank you. And, well, I'm so sorry, Dr. Chitaki, you have a friend here, wherever you are. Dr. Kaida Deshala, you are the president of the Association of Private Practitioners in Nigeria. We talk about patient-centered care. What does the conversation look like when you interact with your colleagues or go for the meetings and conventions regarding patient-centered care?
Thank you very much. I'll greet everybody in the house. Yeah, when we talk about patient-centeredness in our clinical practices, maybe I also have the background of family medicine, where everything being taught there is about patient-centeredness in everything you do. You're taught to know that a patient comes to see you, you're not talking of just giving biological solution alone. We want to talk about the social background, the culture, the preferences, what are situations around that patient at that time. A single mother, somebody's just lost somebody, you know, the emotion and all those things. So when you, if I were to go by my own training, I mean postgraduate training, I'll be talking more deeply that is actually what the training is all about. That we talk about biopsychosocial approach to handling, you know, patients' cases. And as far back as 2011, this was brought into the country. National Postgraduate College started with the diploma in family medicine. It's another way of trying to get the general practitioners, especially, though it's open to every practitioner, because the pioneer class, we had professors, consultants, surgeons here and there, and all those, and we all came to appreciate that. Yeah, there's really a way of codifying how you see the patient, and like the two co-panelists had spoken, you actually don't see that patient like an abstract. You see that person as a human being sitting before you. You don't only see the pain he's complaining of right there. You go beyond that to see from family, from background, from social, and every other thing. And that is what is encouraged and should be practiced. That's what gives a good clinical, service.
All right. Thank you so much. Well, we're getting there. It's time to hear from Dr. Shinkoya, who has been a medical practitioner for decades within and outside. And I'm sure that your perspective of patient-centered healthcare, you may want to share with us the similarities and differences of what, from your experience now, you preach or you consider as patient-centered healthcare.
Thank you, and good afternoon. The issue, well, first I wanted to be honest, sit down among the audience to hear patients talking. And I'm happy for my sister here who has been on both sides. And of course, all of us, it doesn't matter where you're a medical doctor, you will one day need healthcare, so long as we all remain human and alive. I have, when I was just even paraphrasing what to share, last was to check my eyesight in the hospital. What I would consider my experience was and I was happy, one of the issues was waiting time. Okay, I thought it was something I would go in by 9 and finish to attend some of my meetings from 11. But believe it or not, I ended up leaving the place around 4:30 p.m. Yes, and this was not a public hospital, right? So patient experience and perspective can differ. But from my experience and what we try to preach, first of all, this is it's a very, very good beginning for us to continuously engage. So the platform to engage has not been there for most times you have this experience. But from the concept of, preaching what is patient-centered care, the giver of care, which is us, the health providers or health workers, what we always preach is to think and look at that. One of my panelists have said is like we always think we've come to do these people favor. Yes, that's one of the misconceptions. But going further, what we say and try to put on our people's mind is that look at that person as your relative. Look at him or her, your father, your mother, your sister, standing in front of you, or you are standing by his or her bedside that you are administering care for. And how would you want to treat that relative of yours? I think that basic concept overrides or would probably override a lot of other issues that come in. Yes, we are tired. Yes, we are overworked. Yes, there are not enough hands to take care, but quite often, attitude is the major problem we have. And that attitude would, in my considered opinion, checkmated with this kind of platform coming to be available. Because if the person knows that, yes, this person now has a platform, has a voice, like we said, to complain, it's like the eyes and ears of the medical director. My good friend, chief medical director of LUT is here. How many he sees? The institution sees thousands of patients. How many places can he be at the same thing? Even if he tries to walk around the hospital, he cannot touch, maybe 5% or 10% of the place. But the patient or the client, maybe you should go call them clients. I work in a setup where we try to use that these are clients, not patients. Because patient is a kind of the reason that makes you to be like you are the guy on top of these people. They are clients, yeah, in the whichever, whether public or private, indirectly, they are paying your salary.
Thank you.
And you should give service. Thank you.
Thank you very much. So again, we now have a broad perspective of what patient-centered care is, and I find it interesting because I was hoping that there would not be repetition, and absolutely, it's been very impressive. So now let's dive a bit into the conversation around the theme of this event: reimagining healthcare, improving patient experience with technology. You, and I'll start with you, Dr. Shunkoya. You touched on what your experience was as a patient. Now, as an owner of a hospital, what would you say are the biggest gaps in being able to satisfy the patients as you would love to do? And if we can take it a bit further now, are there any of these gaps that you have observed that can be filled by technology?
Well, I've probably touched on it already. The gap is the reporting format or basis, and the fact that both parties, either the caregiver or the care receiver, now being empowered and knowing that there is such a seamless and easy way to give feedback. So if I'm standing like that place I was mentioning, where I took care of went to take care of my eyes, right there while waiting, where I expected to spend 2 hours, and now going to 4, 5 hours. I wouldn't even wait, but I will buy this and thank God it's all phone enabled. So I think the presenter didn't mention, it was like you didn't need a laptop to do this. So your phone is all phone empowered. So right there and then, I start the engagement. And of course, so, even if it's not addressed there, but maybe the next time. So the platform is a very key tool to bridge that gap, as it were. And I think that's the main focus of this, and I strongly believe that we will definitely leapfrog in making sure that our attitude also change. Because sometimes, quote unquote, high service, yes, maybe if I'm on the floor, my staff will be jumping about and trying to do themselves. But my concern has always been when we are not there as the leadership, what is happening behind us. And you see how the clients to be given service.
All right, thank you very much. And we just had joining us, thank you very much. I understand he had to move some things around just to be on this panel. We sincerely appreciate Mr. Olatunji Adebayo for joining us. Well, we were just talking about the theme. We had talked about patient-centered care, but we want you to talk to us as a consumer. We've learned quite a number of synonyms for the word patient this morning. We've at some point adopted customer. At some other points, we've said clients. So the panel has agreed to now call them clients. Those in support say aye. Those against say nay. Deniers have it. So, Mr. Adebayo, what has been your experience? And again, yes, we're all patients at some point or the other. What has been your experience, either yourself as a patient or as a relative, as a consumer, as a client now, as a stakeholder, in terms of care giving, in terms of healthcare delivery? What has been your experience? And if we hope that the Honorable Minister of Health will still be here to serve us, but if today you're announced as the Minister of Health in Nigeria, what would you do differently to make things better?
Good afternoon, House. Good afternoon, co-panelists. All right, to address that, I don't think that will be possible because I'm a lawyer by profession. And it's not possible to appoint a lawyer as a Minister of Health. But coming to your question, I had a very horrible experience. I'm speaking as a patient now. As a client, sorry. My apologies. I had a very horrible experience in January 2021. And I believe very strongly that if the doctor had done what he was supposed to do, probably my wife would still be alive today. The name of Dr. Adeshola just rang a bell because I got a call from him on behalf of the doctor that misbehaved. And he was trying to persuade me to not to escalate the whole situation. The trauma of a horrible experience by a negligent doctor cannot be imagined. Because the client will have to manage the trauma and also desire to push to serve as a deterrent for justice. Thank you, ma'am. I think this is a very good innovation because as you manage your trauma, you can also push out your narrative without necessarily going to anybody. I was talking to my colleague, Mr. Barrister Kunle, that I just hope that, because then when I got a call from the president of Lagos chapter of private practitioner, I think it was Mr. Adeshola, he was trying to say I should not push it, that I should just accept. Yes. But the trauma could not just, I was not coordinated. And I don't wish it for even my enemy that they should go through that. So this is a very good concept. But the most important thing is the sanction, the enforcement. Because if you push out the narrative and it's not, and it is handled with, as a court, because I was telling him that if Kunle is my friend and somebody brought a story to my table that he did something wrong, the courage, the boldness to push for a sanction might be almost impossible. So I think I don't want to recall the experience, but I believe if the man had done what he was supposed to do. For example, he called that morning when my wife called me that I was not around. She was staying with my mother-in-law. And he assisted with the first child that we had. The boy is 8 years today. And he did very well. That was why we trusted his judgment. So this time around, if you did a CS for a 32 weeks child, and he advised that we should bring out the baby immediately, what happens to a 34 weeks baby? When my wife was, feeling the pain, he said it was a forced labor at 34 weeks, whereas at 32 weeks, you advised that we should bring out the child. Now at 34 weeks, you are saying it was a forced labor, that it was not time yet for her to deliver. It was a very terrible experience. So I think with a platform like this, people can put out their narratives and also get justice. Thank you very much.
Please accept our heartfelt sympathy for your experience. And the key message is enforcement. And yes, compliance and enforcement. We are happy to have, if we've had a teacher as a Minister of Health in Nigeria, if having you as a Minister of Health would help with the enforcement, being a lawyer, it wouldn't, I don't think it would be a bad idea. Let's move from there to your friend now, Dr. Adeshola. Dr. Adeshola leads private practitioners in Nigeria. Dr. Shunkoya touched on how technology can help in improving patients' experience. Now, some doctors have also battled with combining how digital health can help with what their clinical training and experience is. I'm talking about a doctor who was trained when there was no telephone, and now having to rely on, mobile technology and all of that to determine or manage or record and all of that a patient. How do you think a Nigerian medical practitioner can manage their clinical knowledge and experience and judgment without compromising what technology brings to the table?
Thank you very much, moderator. I want to use the opportunity to also express my sympathy for the loyal co-panelists. I will not remember the case you mentioned. The way our association is structured, we have chairmen in every state. They are heads of the association. So if anything had happened then and they called, they will have called my Lagos State chairman of the association. I am the national president. It's when things get beyond their handling, that's when somebody like me can be brought or be, contacted. But whatever has happened, I sympathize with you and the family. And we also learn every day. A platform like this might be one of those solutions to things like this. That is not to say that sentiment will not be the best thing for all of us. Like I said, I once led the fight about paying hospitals in Nigeria for emergency treatments. What we kept hearing is hospitals don't treat emergency. Doctor who refuses go to 5 years in prison, go to 2 years, go to this and that. The National Health Act came out 2014, and we started agitating, not until 2018, before the National House of Assembly, in their wisdom, now passed a bill that now says there's a particular part of the budget that is called consolidated, devoted to things like that. And a percentage of that should be used to pay the emergencies. So anybody rushed to any hospital should be attended to, and you send your bill, which was a very good idea. But between 2018 and when I went back to the National Assembly, I had about 19 senators, including the deputy president, at that sitting. And I had to tell them that up to that time, not a single kobo had reached those of us treating emergencies. So that tells you how bad the system is. And again, I want to correct this impression. Somebody can have the need to have emergency intervention, delivery of the baby at 32 weeks. And at 34 weeks, might not be necessary. You might have to monitor, see if you can buy more time. Whether 32 or 34, neither of them is matured enough to come out. But the closer you are to our benchmark, 37 weeks. Though a lot of gynecology will tell you 30 or whatever, but 37 is common, whatever. So if your wife comes to me and I feel is having, the kind of pain on and off, not strong and all those, we call it forced labor. It's not yet going into labor. I'm not defending anybody, but at least we gain from ourselves every day. So I'm just passing that information that if someone was intervened and delivered at 32, does not mean 32 is any cutoff. There were some things that made them to intervene at that point. Then going to 34, there might be a reason for me to say, look, I can buy more time. I'm sorry, I'm not defending anything, but just to correct that notion that going to 34 was probably excessive or too late. That wasn't the case. And I'm hearing about this case first time. I wasn't the person you contacted. I don't remember the case. But all the same, I still say it. We sympathize and empathize with the family. Mr. Moderator,
Yes.
I will tell you, technology has come to change things, whether we like it or not. Technology has come to change everything about, in fact, not only medicine, but let me limit myself to medical practice. So if you are saying a doctor went to school when there was no phone, so to say, because I don't know when there was no phone anyway. Yes, I don't know. I'm close to 60, but then I know when there was no mobile phone, you will say, we know how we used to. A few of our fathers had at home, others we go to United to queue, and we make our calls. So now that we say technology has taken over the world, it's only going to make our work easier. As far back as more than 15 years ago, I was somewhere around Glasgow, and a friend of mine who has a hospital in Benin was talking, matron, who left my door open. Matron, who left my door open. He had it on his phone. He could see that somebody, that is the door of his office in Benin, was left open. So some have embraced technology to that level. And what we should be talking of is encouraging every other person. And there are many ways government is doing that. The current team of Federal Ministry of Health, they are working day and night. I must tell you that. They are working day and night. Yesterday, I attended 2 national meetings. Since the loss of the son of Chimamanda, there came up this task force committee of the federal government on clinical governance and patient safety. I remember that we had 2 meetings yesterday. It's going to get to a level that the only thing you can do, even with NHI, is now, you have to have a EMR and other technology platform before you can participate, before you can be part of it. And the House must know, the minister, when he was giving us his address, he mentioned the standard committee, which has been there, monitoring what is being done by teaching hospitals. We have suggested that should be extended to every hospital, whether private or government, whether teaching hospital or secondary or primary. So that one is also being worked upon. A lot of things are happening. And technology, again, will help our work a lot. Now, whether we like it or not, anyhow you want to crucify a doctor, this issue of waiting time, it's a pity my colleague here is lamenting. He is part of it. We are all there together to solve this problem together. In his own hospital, if he's sitting there and he has 30 patients to see, and by 2 p.m. you look outside, you still have maybe 20 or something, you won't cut, unless you want to do bad work. Each patient has a particular time within which you can deliver what is proper, what is optimal, what will give that person what is needed. Otherwise, you rush the person, some will die before they come back next time. So if we are doing things the right way, this waiting time you mentioned might not be within the power of that hospital. If they are overflooded and then we don't have the doctors anymore, we don't have the medical personnel anymore. We are talking of WHO saying a doctor to 600 patients. The 600 patients are what you see over a long period. I mean, it's not as if one day they come. But those are the people that you say under your care. We are talking about over 9,000 patients to one doctor in Nigeria currently. And it's still getting worse every day. And now we must also take note of this. I'm actively practicing. I'm sure you will be seeing what I'm saying. I don't know about Professor Adeyemo or Dr. Agoro here or in the public. But in the private now, when my own staff does something that is not proper now, as in coming late or slow or something, I have to be careful how I discipline that person. Because the moment I lose that person, before I get replacement, I know what I go through. So when we put it on the table, it's a very complex thing. But those of us that are positive mind must continue to encourage on the positive path. But technology, talking about technology, it's going to help a lot and gives us this kind of feedback. Somebody could have seen a staff while you are not there, gets home and decide to put it up here. If we're able to consult that and we look at, we will see what has happened maybe 2-3 days ago in my hospital. I'll be able to look at what time, who was on duty. It's easy to get, and then be able to call that person. This is what they are reporting about us. is not good enough. We should do something. Thank you very much.
Thank you very much, Dr. K. It's always a pleasure listening to you. I was talking about mobile technology, actually. But it's impressive to see that we have, as practitioners, we have adopted technology. Again, there is a department in a teaching hospital in Nigeria that has morning meetings every day. And it's impressive that right now, it's virtual. So whether someone is in Nigeria or not, or on a posting, they join. And I find that institutionalization impressive, because I remember when I was in medical school, there was nothing like that. You all have to cramp up in that room, no matter how many of you, and sweat it out until you learn about each of these patients. So I'm happy to see that Nigerian doctors are beginning to have embraced technology. And I'm happy to see, to note the gap, a challenge that you've highlighted. We'll put a pin on that and come back to it. But right now, Dr. Agoro is a public health expert, not a clinician, a systems person, I would say. One of the arguments that those who are not freaked about technology have put up is that it has a tendency to promote inequality. Because MyVoiceMyHealth can't be easily used in Lagos. Can we say the same of Funtua in Katsina? And if that is the case, or how then do you think we can ensure that digital health, or technology rather, will help improve health across board and not lose some others along the line?
Yeah, thank you very much for that. That is a very interesting question, because amazingly, my dissertation for my PhD was on cultural competency and delivery of healthcare in Lagos. However, how can it be delivered in Funtua? Is the last word that I said, cultural competence. You cannot fix, or you cannot deliver service in English to people that are in Funtua, taking into or assuming that they will speak English, even though Nigeria is an Anglophone country where we have English as an official language. No. Nigeria is one of the most diverse countries in the world, with over 230 dialects. If you don't take that into context, use it into technology, you will lose the patients, you will lose a good share of the public. Now, where I like to use as what I like to use as a comparison is, I say this without fear or favor, Nigeria has one of the best banking systems in the world. In comparison to UK, Canada, and America combined. Now, flip it. Why can't we use the same system in the health sector? At least, if you've called any call center in any of our banks, you will know that they ask you Pidgin, Yoruba, Hausa, Igbo, at the barest minimum, using Wazobia, and then Pidgin, of course. If you do not model technology, I used to be the head of eHealth, Lagos State Ministry of Health. If you do not model technology for the people that will use it, using graphic, all this English is good, or the words. My house help got me using voice note on WhatsApp. Oh my God, that lady can communicate. And I tell you, she's from Cotonou, she doesn't speak, she speaks a bit of French and Egun, or whatever their local dialect is. But she communicates whatever she wants. And I can hear her concern, the lack of it, and all that in her voice. Now, the lady that did the demo, I really, really give 2 thumbs up for that voice note. Because it's not everything, and I tell that to my daughter, it's not everything I can put into words. But if you're listening, it's not just the words, it's not just the body language. The other part of it is what is not said. If you connect the dots, you will do a better delivery, because technology across the globe, at least we know that it's not English bound only. If you do not modify it to the people you're trying to connect to. So if you are doing that in Lagos, for example, in English or Yoruba or whatever, you're taking it to Funtua. Then you have to model it in their dialect that makes sense to them. Because once it's in English, I can tell you that I shut off. Even though I speak English, I know that if I hear it in Yoruba, it catches my interest. And I've seen that in care being delivered to another nanny of mine who went to Canada with me. And she was having heart palpitation, and we had to go into the hospital. And the GP comes in and started talking to her. Of course, she's not lettered or literate, whichever one you want to use. And she was trying to explain whatever. And I didn't say anything initially, because if you know the system, you know the system. So I told and the doctor was dismissive and was ready to write whatever. And he now asked me a question, which was very, very integral to the care. I said, "Are you a relative?" I said, "Yes." I said, "I'm a public health professional. I swear to God." He went out, came back, and said, "I will have to refer you." He wasn't going to refer, because what she had said, she wasn't communicating with him. When I spoke, saying that she has a heart palpitation that she wasn't having before and all that, he realized that he wasn't going to just keep it moving. So he took more time and said, "I will have to refer you to a cardiologist," because the language changed. Right before me, the language changed. Had she been able to not communicate or whatever happened initially before I spoke, it would have just been like me going. When I spoke and he heard my accent, I said, "Okay, I can't dish out rubbish." He dressed up and said, "Okay, madam, we would have to refer you to a cardiologist," who now did the full details. That integral index, if we may, changed everything. It changed the dynamics where the patient experience now changed, even though I'm saying this, but the experience was like, okay, he didn't know, but the other question now becomes the gap in the communication is almost more important than the practitioners themselves. You can have all the experts in the world. If there's no communication, you're not going anywhere. Thank you.
Interestingly, you've highlighted something around communication. And for me, how does technology help us communicate better as patients and as doctors? I have Dr. Oshunkwaya pick that, but you've also opened another aspect which has to do with trust between the doctor and the client, which is what Princess will take. But can I have Dr. Oshunkwaya tell us something around that?
Straightforward. I was just saying that Dr. Aguru was the voice of that nanny who happened to be the client for that hospital. And thank God she was physical there. MyVoiceMyHealth is feeling that I was going to feel that for millions, perhaps. But before that, I just wanted to highlight the fact, starting from my good brother, and again, so sorry for your experience. But we all need to realize that health, of course, is general balance. Health is wealth. Health is GDP. When you read papers in our country, they don't even mention what is the health industry contribution to GDP. You need to work on that, my brother. But it's a major do, my brothers and sisters. But back to what I wanted to quickly highlight in terms of medical errors. The hospital accreditation, of course, good minister have started good work on it. I think it's been on before, but maybe the health ministry is maybe a bit of on a speed track on it now. But of course, hospital, the quality of care is a major problem all over the world. I was just reminding myself about the Joint Commission International. I was privy to work in a hospital, or headed the hospital where we got one. But the history struck me. The publication "To Her is Woman" was the first thing. Thank God we have Meta AI now. Everybody can Google that. "To Her is Woman." That was some 1999 publication. And while I was sitting down there, that report spotlight on ongoing medical patient safety failures, estimating 44,000 to 98,000 annual United States hospital deaths from preventable medical errors. Okay? Those medical errors are from errors including infections, injuries, and so on and so forth. That is in the United States. I think you mentioned the second one now. One include for yourself, yeah, now you're there. So we all have to participate. There is no doctor-patient thing. And I think with the world of technology, it has brought us, it has leveled the ground. Level from the day you used to go to United to pay $240 to call UK for 3 minutes to now in our hands, whether in your bathroom or wherever, you can call anywhere in the world. Right. And that is something I believe that My Voice, My Health will bring if we all decide to adopt it. So the public needs to know that this is their baby to accept and nurture and use to help us to serve the clients that we are all talking about.
All right, thank you very much. If I were not in the same WhatsApp group with you, I would have charged you for the promotional speech that you just gave now. But yes, My Voice, My Health has come to stay. Now, I'm told our time is actually up, but I'd like to ask, take this comment from Princess, and take it as your parting shot. How does technology help us build trusts between the doctor and the clients?
Right. Like everybody has said, technology has come to stay. I was actually, thinking about what transpired between you and, over there. And one of the things that came to my head was that, there's Google Translation. So if the person can't communicate in your language, it actually happened to me, although it wasn't a case of hospital case scenario or anything. It was just a case of someone that I needed to get something from, and we couldn't. She's Spanish. I only speak English, and she was actually the one who said, translation, and then she would say everything she wanted to say, speak it into the phone, and the phone will translate it into English for me, and then I did the same thing. That can be extended. There's telephone where we have telemedicine. I think they have telemedicine in Lagos now, where we have telephone consultation in the UK, where you can call your doctor. Sometimes they don't have to come to you. Sometimes they have various things. So technology is the way to go. Technology is the way to go. Another thing that is happening is that even the medical practitioners, well, I'll say in the UK, they encourage you to actually, use the phone first, to explore other avenues. There are certain things that's wrong with you. If it's a common flu, if it's a this and that, go to your chemist, go to this, go to that. You don't have to come to the hospital. So let's begin to also give awareness. Let's circle back now to our clients.
All right.
We need to give awareness to our clients. And I'm going to say this as a parting shot. We can't keep putting all of these technologies up there and out there. We can't keep going into all of this framework of how we want to. Again, we are not being customer driven. We're being customer focused. We become more customer driven when we start connecting with them, the stakeholders, the focus group, the elaborate group, where we start telling them what we are doing and how they can use it and how it's going to pay them to use it, how it's going to benefit them. One of the things that we need to start doing as healthcare practitioners is to have a charter in place. have a charter. What is your service charter? Not your medical charter, your service charter, your service delivery charter. If you have that, that means you have a standard that the clients can expect you to deliver on. And if you don't deliver on it, my voice then kicks in to say, they told me they were going to, I was going to wait for 2 hours yesterday. In this hospital, I was waiting for 5 hours. Why? I need to know. Something as little as that. So you all need to have your organizations chartered, have a standard of your service delivery so that your clients can have something to hold on to when you're not delivering, and also gives you the motivation to ensure that you are meeting your set standards. Thank you.
Thank you very much. I feel like going to Mr. Adebayo now to give us an insight into how this technology can help us promote the rights of the clients. First, as a lawyer. Second, as one who has had that kind of an experience. So how do you think technology will help in promoting this right, especially going by what MyVoiceMyHealth seeks to bridge as a gap?
Thank you, Mr. Moderator. Well, let me take it from the first part of your question. MyVoiceMyHealth would help the advocacy for patients because they can present their story, they can present their narratives, but most importantly, there should be a backup, or shall I say, a team that will take up their narratives and then push it out there. And I'm insisting on sanctions. That is the only way, that is the only justice that the patient can get and get comfort. So the second one you said is, as a lawyer, I think there should also be legislative review to drive training and retraining. And perhaps there should also be a task force that will go about our hospitals to check the standard. There are a lot of funny, terrible hospitals out there, just interested in Naira and Kobo. So the medical practitioners, the NMA, should also ensure standard for the practitioners. Thank you very much.
All right, thank you very much. That's quite exciting. So let's take it this way, Dr. Aguru. Where do we go from here? Take it as a parting shot.
Where do we go from here? I was just talking to my newfound brother, I should say. From a public health perspective, where I believe we should go from here is that I used to be the team lead for hospital review assessment at the governor's office, Lagos State Governor. And over the course of the assessment, we realized, at least from data that we collected, that a good number of the patients who were in hospitals, number one, did not need to be there, especially secondary and tertiary hospitals. Let's start with that. If we can, let's say, because at that time, Lagos State, this was about 8 years ago, saw about, give or take, 2 million hospital visits. If we can reduce that, let's even take it to 750. Our doctors, the gentleman there said that doctors have jackpot, we don't have enough. Nowhere has enough. COVID proved that. Do you understand? I was a frontline worker during COVID. COVID proved that. So let's put that aside. We can't control that because medicine is not a course you can have a crash course on. There's no school that does it online. So there's nothing like that. So the only thing we can do is prevention. Go back and stop the number, or at least slow it down. So the number of patients or clients, I take that back, clients that need expensive medical practitioners' attention. That way, they can get paid better. I am an advocate of getting our doctors paid better. But please, let us not be confused that they will be paid equivalent to a medical doctor in US, Canada, UK. No. That is an illusion. Because you have to take into consideration that a medical doctor in the United States pays for negligence insurance. Oh, it's a new kettle of fish now. You do something wrong, I will sue you from here to Bombay. So the circumstances, the indices are not the same. If we can do that, because that is within our control, better than trying to say, oh, 3 students should go into school and do medicine. There's a possibility that only one of them would finish. So if we can try to do that so that the quality they give is from the best of their being, with what they are being paid, giving better quality. That way the patient has a better experience and the trust is built better, where it guarantees that they will come back. Thank you.
Thank you very much. Well, Dr. Adeshola, I know that you would have some reactions, but we have about 2 minutes for you to take the reaction and tell us where to go as a body of private practitioners from here. You can actually tell us how you can use digital technology or technology for the patient's charter, if that's something you're considering as an association.
Well, thank you very much. Like I mentioned earlier, a lot of things are even going to start with. I believe more than 80% of private hospitals will have embraced EMR, EHR, whichever one, whatever levels now. And like I was at the Federal Ministry meeting we had yesterday, I was giving that information that, look, if you go around now, the condition that if you don't have this, you will not be able to be a player. It's like people have passed that. I only requested from the ministers yesterday, they should give us accredited vendors of the technology, because so many are coming every day. Somebody will come and tell you, oh, is this also? I don't want to mention any group. I have them. And I told them yesterday, we have a conference coming up in Port Harcourt, ending of April. See the number of new groups that are coming. Oh, we can now do this. We can now do that. We will add it to the other one. So even at that, a lot of us practicing, we are even ready to migrate. If my system has not been able to capture properly my billing, my whatever, and somebody said I will add this to it, or to monitor the drugs or whatever, and you add it to what I have, I'm ready to migrate, and they are ready to play games, and we blend and we meet at, So we're embracing, what's it called, technology every day. But now to further equip or push us further, look at something like the emergency medical treatment thing now. You cannot be a player if you don't have your technology in place. So you can treat anybody. If you cannot send and they see things, through the system, you are not going to be. That case you have treated and you have lost. So it's not just a matter of how we're going to. We're already into it, and it can only get better. And the better for everybody. Now coming to something like MyVoiceMyHealth, where we have something, I don't know if the promoters of this, they say you are a doctor now. I'm careful. So Dr. Katie, honorary.
MDCA, please take note.
So honorary doctor, because you are rubbing too much with doctors, you begin to tap some things. Now, I was going to talk about this. I don't know if you are aware, your team, there's the QR code that's been deployed now by a farmer in Lagos State. They come to your hospital and they stick something with the QR code. So any patient leaving my office can go there, scan and say anything they have experienced in the hospital. And they are insisting they are the ones to come and paste it. So they are not going to paste it somewhere where you can hide it or keep it away from. That is another platform that is really to tell you that people, and I just told you, the moment the particular case I mentioned happened, there was this emergency putting together of task force. We all heard about it. And we're meeting too frequently, putting a lot of things together. Then the minister mentioned when he was talking about the standard committee, which has been working with the tertiary. Some of us have said, look, let it be extended to every hospital. Especially somebody like me, I always tell them, because most things they bring, they face government, public hospital almost all the time. But we are there now to always nudge them. Let this thing be thrown open to everybody. So all these things are moving and at the right pace. We are moving the way we should. The only thing I want to mention, and it's like a caution note, I'm sorry I have to say this. As much as we want all these things, they cannot come overnight. There are some problems that are on ground that we cannot solve significantly in the next 10 years. We have not been able to reverse JAPA, whether you like it or not. A doctor is a human being. If you have worked where you have a PC clinic, you want to write chloroquine. If you have a good nurse working with you, you have seen the patient, you have done whatever, and you are writing paracetamol. That nurse will come back. Doctor, see what me? I wrote this. Because you're already getting fatigued. You are getting overworked. And that's why we cannot solve overnight. And it's a thing that all of us must be able to contribute one way or the other towards solving. It's not just about looking for how to hammer people who are devoted to also rendering the services. Thank you very much.
Thank you very much. And FYI, Dr. Adeshola, today I'm just a moderator, so I belong to everybody, and I belong to nobody. Okay, we'll take a group picture, but just before then, we'd like to have one or two words from members of the audience. Are there some things that had been running through your minds that you'd like to let out before? We would like to have a comment from this, I believe, from him as the CMD now, or the minister.
Join together, all of the above. You know, the first thing that went through my mind when the young lady was making the presentation about the platform is that what is really the end point? You've collected the data. Is it an academic exercise? You've collected the data. So what do you do with it? It's very important that we know. But the good thing about this, for some of us that are in a public hospital, is that this is a good platform, and I hope we are going to make the best use of it. Because if you give the people the opportunity to use this mechanism to pass across their complaint, their compliment, and so on and so forth, is better, far, far better than what we currently see. Because we have a deep problem. It's very deep. Dr. Adeshola knows that something goes wrong in our hospital, public hospital. The next thing you see is on social media. You know, there's a problem in Nigeria, particularly. People are afraid to go to the hospital, particularly we in the teaching hospital. And it didn't just start now. When I was growing up in Ibadan, if they say they refer somebody to UCH, that is the end of it. It's still there. Now, somebody now has one or two issues in our hospital. You now escalate to social media. You are driving away people away from the hospitals. That's the truth. So this platform is very important, and I hope that we are going to make best use of it. That's my first comment. The second comment, based on even when the lady was piloting the system, and I realized that attitude and other things are the major. And we are talking about patient-centered. We are forgetting that the people that are treating the patient are also human beings. What some relations go through when they come to our public hospital is worse than even the patient. Patient will be on the ward. You go and pay this, you go and pay that, you go here and there. Many of them, when the patient is well, it's the reverse. So I think, yes, patient-centered, but with human-centered approach. We need to take care of those who are taking care. You are talking about some of the issues that we have in the hospitals. For those who don't know, the issue of JAPA is a major, major, major problem. Let me give you a perspective. The government, I'm not talking about I'm just talking like a CMD loot now, not the minister. We struggled to get government to give us Weaver to employ 1,000 people for this year. 80% of them are clinical. Clinical meaning doctors, nurses, pharmacists, and so on and so forth. We did the interview. Do you know what? Out of 800 for clinical, we were not able to fill for 484. 484. We are not able to fill. I'm talking about what we did about a month ago. So, it's going to have effect on whatever. So, it's a big issue. And I think when we are thinking of patient-centered care, we also must, the people that are taking care of the patient. That's human-centered approach. I would rather say human-centered rather than patient-centered. It connotes some patient, yes. But the question is, the people that are treating, even there are some hospitals in the US and UK now, when you want to design a hospital, it's human-centered design. Everybody will sit down. The NGOs will be there, the patient relation will be there, the farmers, everybody will be there. Because hospital is not only meant for sick patients too. There are people who go to the hospital, they are not sick. And people that are not working primarily in the hospital, they are healthcare provider. Thank you very much.
Thank you very much. I was hoping that Katie would have one or two comments, especially based on the first question of Prof. But then if we still have, we can still take two more comments from the audience. And then when we're back, if there are other comments that you need to take, we'll take that. So let's have you, and then you. Okay, thank you.
All right, thank you very much. All protocols duly observed. One thing is certain. Okay, Kelechi Williams Ibokwe, a medical doctor with Octosoft Technologies. Technology has come to stay, like our panelists rightly said. It's something that is here and will continue to help improve healthcare system or healthcare service delivery in Nigeria. I've been of the opinion 3 years ago, addressing my patients as clients, right? In fact, I even had several fallouts with people on social media saying I don't know what I'm doing. I'm a quack doctor, because people who come to receive services are patients and not clients. But I see them as clients because they are the ones who bring in whatever it is that the doctor is using to, fend for himself. Okay, so they are clients, and that's the most important thing. Now, for technology, we have several ways. Like Dr. rightly said, a lot of people come to the hospital in Nigeria for frivolous, forgive me, reasons. Okay, I ate beans and I'm purging. I was on call 2 a.m. Someone came to wake me up and said he ate beans. He has been purging, he ate beans. He has been purging during the day, but decided to come at 2 a.m. Okay? So, and I asked him, he said he knows that nobody will be in the hospital by that time. That is why he came. Okay? Yeah, exactly, to prove a point. So, now that's there. We also have people who have headaches. Various, just simple things that telemedicine can breach. All right? Telemedicine can breach. And I'm grateful. That's why we have the likes of Arjolad, Octosoft, who have AfiaCare generally. AfiaCare has various, companies under them who are doing this already. Okay? Octosoft has a QMS system, queue management system that Arjolad is using currently. And for queue management system, my idea is when you book an appointment to see a doctor, and when it's close to your time, say 30 minutes or an hour to your time, you come to the hospital, and you will just walk in and see the doctor and go. You don't have to wait 6 hours, 7 hours just to see a doctor for a headache. You can book a doctor via telemedicine to see a doctor, or an appointment via telemedicine to see a doctor. And you don't have to. If you need to be referred, then you'll be referred by, the doctor who attends to you. All right? Thank you very much.
All right, thank you very much. I take that to be more of a comment. Thank you so much. So we'll take this last question / comment, and then we'll come back to Katie to respond to Prof.
Thank you very much, all protocols duly observed. My name is Olabisi, a pharmacist. I'm working in the regulatory. All right, so Dr. Kelechi actually said part of what I wanted to say with respect to, if we have a system whereby people can actually have access to their doctors via an online platform to explain, so that it's not every time you have to go to the hospital. The headache is less on both the patient and the hospital as well. Yeah, but my question with respect to what the lawyer went from, very sorry about that, I pray the Lord will comfort you. He's mentioned something, and I think is also very key: deterrent. Because I can imagine the trauma, right? But then you said something, and I was discussing with this beautiful lady beside me. So because you don't want to lose one of your best hands, and then you're like, oh, okay, so we should tamper justice with mercy. It can be very, very painful, yeah. Because I remember I also had an issue, 2000, yeah, in Lutz. I was supposed to have a minor surgery, and then the consultant that was supposed to see me was not available, so he handed me over to some doctors. But whether we like it or not, I don't know what people will say about this anyway, but the truth is, for every Nigerian, or maybe for somebody like me, if I'm going to the hospital, I'm always praying, God, please go before me. And then whoever is going to be at the helms of our affair, let it be, just order the person's steps and all. So that time, the doctor was unavoidably hesitant because he had an emergency, and then he had handed me over to some doctors. Now, at that point, right, two of them, one was saying, oh, so he told another person to come oversee what they were doing. Then one said, oh, I've never had this before. I've never done this before. And then the other one said, oh, I've only done it once. And right in front of me, right, they were discussing. And he was telling them, oh, because of where the incident is, I'll have to put, and in my head, I'm like, God, what is this? So what am I saying? Backing him up. When people know that there are consequences for whatever they are doing, everybody is going to sit tight. In as much as, yes, you don't want to lose your best hand, but are you going to lose people at the detriment of other people's? Yes, I understand. Like, I'm a pharmacist, so I've worked in the hospital before, and I can understand the frustration of you having to do calls, so many patients and all. But at that, we should also have that human fact that if you're tired, you're tired. Take a break. Thank you.
All right, thank you very much. We'll take, because the CMD has to leave now, Alex would have a feedback from, a comment from from Katie, our CEO of Patient Academy International. I'm also reluctant to take the reply to that comment because I don't think it was much of a question. It was more of a comment. So that we can move forward. Again, it's a matter of chicken and egg. I always tell people that I love telemedicine, but my experience during COVID got me really scared. You tell people, don't come to the hospital so that you don't catch COVID. Whatever problem you have, go to this digital platform and lodge the complaint. Guess who is queuing up in front of the hospital because I just prefer to see a doctor one-on-one. So it's a conversation we'll keep having. If Professor Adeyemo managed to get 484 out of 800 that he needs, and then one of them comes late to work, and he places the person on 2-month suspension, that's fine, but it means that half of what he has is half of what he needs that he has is getting depleted. Again, I don't think there is a right or wrong approach to it. But one thing is important, and it will be a key message from today's conversation. We've agreed to move on in a patient-centered, more of human-centered approach to our healthcare service delivery. And with this, the patients, the relatives, the doctors, the iPhonova technology developer, the government would all eventually be happy and play their roles. Thank you very much, and I must at this point sincerely, oh yes, we'll take a comment, we'll take just a response to the question raised by Prof. And after that, the cake is there. We'll take a picture, a group picture, we'll cut the cake, and then the CMD will leave. We will have interactive session afterwards so we can have further conversation, because I think I'm enjoying this this discussion that has been happening. But please, over to you, Katie.
Thank you very much. A big thank you to our panelists, as well as everybody here seated, and all the various contributions that has been made. I think this is just the start. A lot of things will keep happening, and Rome wasn't built in a day. But I think we've laid the foundation now. We've laid the foundation, and we're going to continue to build on it. And I want everybody here present to see themselves as part of the building team, right? Everybody has got a role. A patient, a carer, a doctor, a nurse, everybody's got a role. And that is why in patient experience, for the last 25 years in clinical governance, patient experience, patient public engagement in the UK, one thing that we always say is happy staff equals happy patients. You cannot have a good patient experience when staff are overworked, underpaid. One staff is doing the work of 10 people, they will not survive. They will only struggle and struggle. And then you come to say, what's it? They'll snap. And they know that they are not supposed to snap. They know they are supposed to be very polite and everything. But when, as human beings, if you've been overworked, you've worked maybe double the shift you're supposed to work and everything, and you're doing the work of 5 people, you wouldn't know it when you snap or say things that you're not supposed to say. So I think that this is a very complex issue. It's not a one solution fit, it takes care of everything. So, but we continue to unravel it, we continue to unwrap it, and I'm sure that we will get it right, and we will lead to show, not just in Nigeria, but the rest of Africa and beyond, that this is possible. We can get to a place where patients or clients, as we said today, becomes a king, where at least they are listened to, right? But we have a situation where we said happy patients, happy staff, happy patients, and we used to have things like in your shoes. So where staff will sit down and listen to patients and try to put themselves in the shoes of the patients. And then we have another section that we say in our shoes, where patients will try to put themselves in the shoes of staff, and so that both parties can understand each other and the challenges both sections sections are facing. So these are things that we regularly do out there, and I think will help us. Now, to answer Prof's question directly about what do we do with this data, I think that's one of the most valid questions anybody can ask. Now, what we're trying to do here is to, number one, change the mindset from let's live in the hands of God. Or when they are very angry, Holy Ghost fire will strike them, and and that is all. They post it on social media. Those seems to be the 3 options most people tend to go for these days. Either they just say, just leave it, just leave it. Mama is already getting old, and this thing happened. Let's not try to find out why and how it happened. We just give ourselves stress, more stress for that. Let it just go. But you see, when you let it just go, you're sweeping things under the carpet. And when you sweep things under the carpet, they will resurface. The wind will blow, and they will scatter around again. And then you come back and sweep again. And that's exactly what we're trying to do, to avoid sweeping under the carpet. We want to get that feedback, analyze it. You can see the analytics with our technology partners, iPhonova. I'm so excited working with them. So this is not a promotional platform, but I can tell you one thing for sure, that it's been a fantastic partnership with them, and the level of dedication and commitment from every single member, from the top directors down to the most junior staff. So big thank you to you guys. We cannot say it, no, but big thank you to you. So basically, what we'll do, we collect the data. When you come onto the platform, you give a compliment or you give a complaint. You can see when it was demonstrated. That information flows to the back end. We can see it. Now, majorly, we use that data. It becomes aggregated. In other words, we are not singling out every single person by name or anything. So we're not going to be identifying you. Yes, we can if we needed to, especially if you have said you want to follow up certain cases and you need further support. There are those we will now go back to and discuss further. But ordinarily, most people that will be giving the information or giving their feedback is for us to be able to say to the government, say to management of hospitals, in private sector, in the government sector, maybe 6 months, 1 year report, or 3 months report, or a monthly report if they want to say, in your hospital, or in this local government, or in this state, the top 5 issues that patients and the carers and people in your area are not happy with are A, B, C, D. Because the data will tell us. We will be able to tell you what the issues are and what people have been raising over the period of that 1 month, 3 months, or 6 months. So we can, the trends, the themes, and the trends. Thank you very much. So that's what one of the things this system will do. And then secondly, as I said, actually the first thing is to change the mindset to that of giving feedback rather than saying either God will take care of it, let's just leave it or whatever. We want people to start thinking, I should talk. I should say something, because that is you giving back to the system. We talk, one of the concepts we use in the UK is that we give back with feedback. So in other words, your own giving back to the community is giving a feedback about the services you received. Because that feedback will it's just like a seed that will yield fantastic fruits. Because we are going to use that feedback to understand what is working and what is not working. And then we will go to the government. We will go to management of various hospitals to say, these are the things that are working, these are the things that are not working. So they will start to manage those cases, to manage those challenges, to improve services. The bottom line here, the bottom line is how can we continuously improve services, continuous improvement. That's the bottom line. And that's what so you give us your data, it goes into the pool, and we can do analytics and show 60% are saying this, 40% are saying that, and that gives the managers of hospitals and other facilities, diagnostic laboratories, and the rest of them, a good understanding of where the shoe is pinching, essentially. And that's what's important. Now, we also, over and beyond that, we are able to assist those who have more life-threatening situations, or those who have been in situations, they don't know where to go. They don't know how to handle it, but they are suffering in silence. Now, yes, at the beginning now, we may not be able to help everybody, but as the services grow and as more funding comes in, we'll be able to extend services to many more people. But what we want to start with is people will come and say, I need support, I need advocacy. Now we can go to them and say, tell us a bit more about what's happened. And we'll be able to have our experts. We have access to the experts. We have people on our board. As you can see, we have people also that we can reach. And they will look at it, where in terms of the clinical side of things, in terms of the patients, the clinical governance, everything, and then they will advise that this is the approach here, this is what has gone wrong here, this is what, and then we will call the other party. We are not in the business, just to clarify, we are not in the business of encouraging people to litigate. That is not what this is about. This is about continuous improvement. So what we want to do is try to, and I'm using this very carefully, we want to essentially be the ones that will look at standing in the middle, so to speak, and to negotiate. That's in cases where there is need for advocacy and further support, to negotiate on the side of the patient or the carer or the relative, to say, okay, this has gone wrong. These experts have looked at it. These are their opinions. What can you do by way of mitigating what's happened? What can you do to support this family, or to, what can you do as a remedy if, indeed there is a remedy possible? So we just want to do this it will hopefully help to minimize the need for litigation. So that's actually one of the big takes. It will help to minimize litigation because we are trying to settle it out of social media and out of courts, right? But obviously and ultimately, it will be down to the patient whether they feel that they need to take it further or they want to sue. That will be their right, and then they will be able to do that. So that is the situation. So those are the key objectives, if you like, of this application, or the whole idea of My Voice, My Health. So I hope that answers your question.
Thank you very much. This is not the end. We're just putting a pause so that we can do some other things and release our prof. So please bear with us. We're going to have a group photo with the panelists now, and then we're going to have the official launch of My Voice, Your Health. We're going to cut the cake, and then we can release our prof. Before we go any further, I want to correct another introduction that we've been doing all day. The gentleman who's been answering your questions is not what I called him earlier. He's the the Association of Nigeria Private Medical Practitioners, Dr. Kayode Adeshola. I apologize. Thank you very much. Okay. I don't mind Prof joining this one. Then we go behind the cake. Ifanova, please join too. And then we're coming behind the cake to have the official launch of My Voice, My Health. Somebody says a closed mouth is a closed destiny. So if you want your voice heard, the only way that you can do it is voice it out. So from today, I hope we've learned one or two things. We're going to have an interactive or a networking session after we've had dinner. And we can, because we won't be able to talk when we're eating. So let's have the only two women there. Okay. I wanted to balance the equation. Thank you. Any other women volunteers? No more men, please. Thank you. Oh, sorry. Everybody say, My Voice, My Health. Thank you.
Okay.
Thank you. Now, we're going to have the official launch. Please.
Okay, can we take the panelists now?
The panelists.
Just the panelists, please.
Prof, sir. Dr. Thomas. Dr. Thomas, the one that is not a doubting Thomas. Dr. Thomas. Ade.
Thank you. All right.
Okay, can I?
Which one? Which part of it?
Okay. Panelists don't go far because I'll still need a photo with the. Like further. Bring it further. Okay. Patient Academy International. In collaboration with iFornova, have brought to pass My Voice, My Health. We're just going to shout, My Voice, My Health, and then you bring the knife down. At the count of 3. 1, 2, 3. My Voice, My Health. Congratulations. Thank you. Women in the fray, please come forth. Adelola. Where's Adelola? The Ijebu speaking English woman. Come forth quickly, quickly, quickly. A thousand apologies. We forgot to recognize the wife of Dr. Thomas. Mrs. Thomas, God bless you. Thank you very much. Thank you very much. If you didn't release him, he wouldn't do this. So thank you very much. Yes, you're not going anywhere. There's food, and there's no how that we've spent so much on food that anyone will go without eating. Even if you're fasting, fasting has broken. Thank you. So, you may not find exactly what you wanted, but eat this one when you get home. Eat the other one. Thank you. So, everyone, there's catering and there's food. Please eat. And then after the food, we'll have, if you have questions and answers or tributes or advice, we will take them, and then we can successfully close the day. Thank you very much. Can my panelists go to their seats so that we can feed you too, please? Panelists, please come and find Otile Agoro, Agoro. All the Lagosians in the house. All right, find your seat. You can't eat. Okay, the man on the turntable, please, for now, so that we're not talking and eating at the same time, please just give us some light music, if you don't mind, engineer or the DJ, if there's one. Thank you. So for now, we're eating. Enjoy your meal. There's no one who is allowed to be fasting at this moment. Thank you. Okay, sorry, a quick announcement. There's a fine gentleman in the foyer, and he's taking headshots. It's important that you take your headshot before you leave, and it's free on the house today. Okay, thank you. Professional headshots, he does, and he does very well. If you see the ones here, okay. So make sure you take your headshot before you go, but take your head with you when you've had the headshot. Thank you very much. Music, please. If by now you haven't been served, you probably are at another function of the Patients Academy family and the Iphonova family. Your attendance is much appreciated. And I hope that all the things that we've spoken about tonight, we will take home, we'll digest, we'll regurgitate, we'll digest again, we'll regurgitate again until we have chewn and it is tidy and it comes to pass. Dr. Thomas, am I with you? See, you too, you'll become Dr. Thomas. DJ, DJ. I'm a medical practitioner too. Herbalist. I did traditional medicine. So, in our own department, we don't have any problem like this. Once we apply it and it doesn't work, you don't see us anymore. We will have disappeared into thin air. Yes, so. We encourage that unless you have an emergency to attend to, we can still banter. I'm sure some of you have questions or suggestions or opinions, and the idea is your opinion must not be silenced anymore. Because we said, Dr. Afolabi, let me hail you. Please come. This young doctor here, this young doctor started from Germany and then went to the United States of United States of America, but also went through Unilag, and then he's tired but not retired. Oh no, he's retired but not tired. So this is one of our very good uncles in the industry, and he is a research fellow. Okay. And what your area of specialization, like you told me, is malaria what? Malaria in pregnancy. Any man that is pregnant, all pregnant women, this is the man you want to see. If you have malaria, placenta, malaria, foot malaria, anything malaria, this is the man. Have you ever caught malaria before, sir? Okay. So the doctor cannot heal the doctor. Thank you, Dr. Afolabi. God bless you, sir. Thank you. Yes, sir. Dr. Thomas has made this possible. Dr. Mrs. Thomas, please somebody turn the camera to me. I know you're very shy. But Dr. Mrs. Thomas, a very shy, gentle woman. And if you can marry someone like this who's been thinking every day, every night, then you can't be totally gentle. But we'll let you off. So thank you. Thank you for your support for this man and for the vision too. Thank you very much. Okay. Now, if there's anyone who has questions in about 10 minutes, because if we said to wait for everyone to finish eating, we might wait till tomorrow. Everybody has their pace of eating. So some people are not even eating. They're Googling the food on phone. Some are Googling the food. You may not find it on Google. So in another 10 minutes, we'll ask you if you have questions. And Dr. Ronke is still in the house. 22 years ago, she was on the team with Dr. Afolabi. How can someone this young be 22 years old? It's not possible. But it's okay. Whatever age anyone claims is in order. Princess is passionate about anything. Don't just introduce Princess to anything at all. She will carry it like it's the last breath that she has, all to the end. So thank you again for your support. And I know that on short notice, every time we call you, you're always there. Thank you very much. The Lord will surprise you. Ma? That's what friends are for. Okay. If the DJ was listening to me, that's what friends are for. But that's hasn't eaten. Please call the attention. Miriam, the last person who looked back became a pillar of salt. Don't look back. If there's anyone who hasn't eaten, please eat. And if you're the daughter of Alao and you haven't eaten too, please finish your food so that we can talk a bit and then we can close. And those who brought equipment can return them. DJ, where's the DJ? Where's the DJ? Who in particular is the DJ? Who? Yeah, that's what I wanted to say. Nobody can do the work of 4 men. If they call you 4 man now.
Thank you for staying tuned. Across Nigeria, allegations of medical negligence are raising urgent questions about patient safety, professional standards, and accountability in the healthcare system. From Lagos to Kano to less resourced states, families say routine medical care has over time ended in tragedy due to failure of the system meant to protect them. Our next report by Uche Ugochukwu examines what the nation is doing to safeguard patients and hold perpetrators responsible.
Hospitals serve as a vital hub in healthcare system. They mainly focus on saving lives and providing full care to patients. But people often wonder what could go wrong in a place with skilled experts and systems designed to diagnose and treat illnesses. Yet, patients still die or face serious health problems due to medical mistakes. This question is on the minds of many Nigerians, especially with reports of medical negligence in some hospitals across the country.
the doctor mistakenly tied, because she wanted to do a tubal ligation, tied from the intestine or whatever, and that led to her death.
While in the hospital, you call the attention of the nurse would not respond. And even when they respond, there will be this sluggishness.
Same thing, I went for medical checkup. They said I should wait for the doctor. I waited. Later on, they say there will be no doctor to attend to me that day, till I should come the next day. What if I die? What if I couldn't make it to that next day?
As the death of novelist Chimamanda Adichie's 21-month-old son at a private hospital in Lagos is raising concerns among Nigerians, the case of Aisha Umar, a mother of 5, came to light. Her family claimed that a pair of surgical scissors was left inside her abdomen during a procedure, which caused her 4 months of severe pain and death. Experts say these cases show bigger system problems, not just personal errors. To back this up, the professionals said there is a weak oversight and poor enforcement of medical standards.
So let's empower the regulatory bodies to have manpower and the skilled professionalism to do regulatory oversight. And at the same time, on the part of the health professionals, let's advocate for non-punitive reporting systems so that we can even see what is the incident. Everybody needs to be trained a minimum of once in a year.
If you look at other advanced nations, these things happen every time. And the key fundamental difference is that when it happens, there is that element of transparency that is very crucial. And and with that transparency, they investigate and then use the outcome of that investigation to ensure that the chances of that happening again is much reduced.
The Medical and Dental Council of Nigeria regulates doctors and punishes misconduct. But critics say it does not regularly inspect hospitals or enforce patient safety rules. This gap, analysts say, allows unsafe practices to continue in both public and private hospitals. Sadly, efforts to get the council to comment on this were not successful. Although victims can go to court for justice, do they really know how?
You need to know your rights as a patient. A challenge that we face on our side, we start, the patient comes, the victim comes, we take up the case, midway they tell you, our community leaders say we should leave it for God. So, and if we keep leaving it for God, we will not improve our jurisprudence in this area.
Added to this are underfunded public hospitals, lack of staff, quackery and weak emergency systems. Experts warn that patients face avoidable dangers because of these issues. They called for stronger rules, clearer laws on medical mistakes, and more funding for patient safety in Nigeria.
Hello everyone, my name is Dr. Abimbola Oshunkoya. I'm a board-certified internist practicing in the United States, where I have the privilege of serving a diverse population in the state of Delaware. With several years of experience as a primary care physician, I've seen firsthand the critical importance of patient inclusion in healthcare decision-making. I'm here in my capacity as a technical advisor to Patients Academy International. Engaging patients in their own care is not just empowering, it significantly improves health outcomes. When patients are actively involved in the decision-making process, we see better adherence to treatment plans, increase their satisfaction, and ultimately healthier communities. Unfortunately, in our own context, patient inclusion has often felt like a distant goal, especially when compared to practices seen in many developed countries. It's long overdue for us to bring this essential concept into our community. I must express my regret for not being able to attend this inaugural session in person. However, I recognize how vital it is to highlight the collaborative efforts we can achieve when we bring patients into the conversation and about their health. We're thankful to have the Health Minister, Professor Ali Patel, who is fully aware of the significance of patient contribution. Having been brought up with this understanding during our residency days together in the United States. It truly embodies the principle we strive to uphold in our healthcare system. No better time to bring this initiative to the forefront, especially when the ducks are in a row. Thankful to the health minister. I'm genuinely excited about partnership with iFornova. By leveraging their technological expertise, we can explore innovative solutions that enhance patient engagement and streamline care delivery. This initiative marks a significant step towards creating a more responsive healthcare environment where technology and personal touch come together for the benefit of our patients. Finally, I want to emphasize the importance of feedback in our pursuit of excellence. Continuous learning and improvement are the heart of quality healthcare. Your insight and experience are invaluable in shaping the service we provide. I encourage everyone to share your thoughts as they will help us to refine our approaches and better meet the needs of our community. Thank you all for your attendance.
Hello, I'm Dr. Arabella Onslow and I'm a GP working in the northwest of England in the NHS, where I've been working for the last 26 years. I am the technical advisor for Patient Academy International, whose journey I have been following for more than 15 years since its early days. And I have been so impressed with the work that they do that strives to put patient engagement and patient need at the front and centre of the quality of health services. No health service can truly deliver excellent care without involving and collaborating with the service users, and that can include not just patients but their families, the wider community, and of course staff members. There is so much resource amongst the voices of the people who are involved in delivering and receiving healthcare, and it is an honour to be involved in an organisation that strives to put that front and centre.
Are you the caterer? What's the name of your
I'm very sorry not to be able to be with you at the inaugural event, and I sincerely wish everybody all the best of the day and look very much forward to seeing how this journey develops over the years and decades to come.
Hold it for me small. Hold it for me small. Did we enjoy the food? Did somebody enjoy the food?
Hello.
Ladies and gentlemen, the lady who catered for us today.
Academy International.
And
I'm very excited to be here. I hope you're excited too.
Let's celebrate the caterer who made the food happen today. Thank you. What's your
through innovative and tech-driven patient experience?
Fretina Kitchen Services. Thank you very much.
Our invitation accepted.
Your hand will be going up. Unless you have a boy.
Social welfare professor Muhammad Ali.
Who else have I not big
CON?
I've done it.
We will be unveiling, as part of today's program, we'll be unveiling MyVoiceMyHealth, a technology platform.
After this photo, it might be worth a day. You might want to say
feedback management cannot be overemphasized.
Thank you.
And that means
washing machine.
not just
Hello.
data,
My voice, my health.
Analyzing
hello. Oh yes, correct yourself.
and being able to understand the themes and the trends.
Thank you.
And using that information
washing
to
machine.
continuous improvement. Yeah. Really
my voice is my
excited
health.
That we are being supported, and we have a partnership with iFornova Limited, the Ford thinking and very creative technology company.
Okay, so I'm going to hand over to a representative of iFornova, the technical and
will have a very positive impact on healthcare delivery.
Technical partners.
Thank you, sir. Abroad.
Okay.
Thank you for being here.
Mr. Ade Adenuga is here.
Together.
So please, before you go, listen to thank you. I beg, before you go. Dr. Rumke, if you go. 12 lashes. All right. Let me hand over to Mr. Ade Adenuga.
God bless.
Hi, I'm Dr. Hamid Adediro.
Good afternoon again, everyone. Not a lot of words. We don't have enough words to thank you for taking time out of your busy schedules to be here today. So we'd just like to say on behalf of the two companies that have come together as one to put this together, Patient Academy International and iPhone Nova Limited, we're in Lagos, Nigeria. We're working globally all over the place. We heard a lot about technology today. We have clients in God knows how many countries and locations as we speak. And they're not all here. So I just want to take the opportunity to thank you all very much for being here today, for taking time out of your busy schedules. So thank you. Thank you for your listening ear as well. And we thank you for the feedback that we know you would share with us. Feedback on the events, feedback on the project itself. We really appreciate that from all of you. MyVoiceMyHealth.com is a good place to go, and at that place you can also give us feedback on many other things, including whatever health situations that have occurred. So on behalf of my co-directors, on behalf of the board of Patient Academy, we just want to say thank you very, very much for sharing your day with us. Thank you.
On that note, for everyone who was invited today, when you're ready, you can go home. Unless you're helping to pack the tables and chairs like the board of directors of iPhonova. He was the one arranging the carpet when I came here. It's called selfless service. So thank you very much. On a more serious note, if they ask you who spoke to you today, my names are simply Abidemi Oluwatoyin Alaran. You may find Abidemi in the book of John chapter 4 and verse 7, which says, if you abide in me and my words abide in you, then you shall ask what you will, and it shall be done for you by my Father